All right, everyone. Good morning. Good morning. It is that magic time of 8:30 when we're going to begin our Southwest region version of Mpox training for healthcare providers. We are so glad you are here today. My name is Jenny Calhoun. I'm a nurse consultant with the Virginia Department of Health at the Division of Disease Prevention. I spent most of my nursing career at a local health district in the central region. And in the last 4 years, I've been working primarily in HIV prevention, and I see some of my HIV prep cohorts out here. So thank y'all for everything you're doing, and I'm looking forward to meeting y'all that I don't know. And it was a little brisk this morning. It reminded me of my days. I'm a Hokie, so I can't believe it nowadays because it's not important to me to be cool anymore. But the whole time I was at Tech, I never wore a coat, ever. So was that cool or dumb? Who knows? But anyway, a little bit about housekeeping. So I want y'all to make sure you please sign in if you're going to apply for credits. That's how we're going to track your attendance. There's a couple of emergency exits if there does happen to be something that happens. For those of y'all that came in to my right, you can go out those doors. You can also go out these doors, and you can either go to the left or the right, and it will get you outside. As far as restrooms, they're also in similar places. There's restrooms to my right, there's restrooms to my left in the vestibule, and then there's also some right around the corner. One thing we haven't found is vending machines, so if y'all find any, let us know, but we don't think there's any in this building. But please help yourself to morning refreshments. Out there we've got coffee, juice, water, and some yummy looking pastries, so please help yourself. If you haven't already, if you have the opportunity to actually turn your cell phone off and take a break, please do that. But if not, please at least silence or vibrate them. And if for those of you that are going to seek credit, please make sure you, Donna Moore is our program training coordinator, and he will be sending you an email after the presentations today. And once you do the evaluation, it needs to be turned in by February 15th for you to receive your credits. So I wanted to thank everyone that's been involved in this training. There's a planning committee of some of us that are here with you today, including myself. You'll meet Dr. Lauren Lee, who will be presenting after me. And then Dr. Safri Diawara, who also works with me. They both work at the Virginia Department of Health. We also have Donald Moore, like I said, our training coordinator, and two of our important people back at the office, Susie Silverstein and Sue Skidmore. We want to thank our presenters as well as our panelists. Dr. Lauren Lee, she'll be presenting, Dr. Anthony Buffo-Boni, Dr. Robert Brennan, and then also y'all's regional epidemiologist, Paige Boardwine. And then thank you to our Medical Reserve Corps volunteers who helped you sign in out front, Jean Cook and Charlene Trulick. So thank you to all of them, but most of all, thank you to all of you for showing up today. I wish we had time to go around and introduce each one of you so I could know who each one of y'all are, but let's at least find out where y'all are coming from. How many do I have out here from Linnawisco Cumberland Plateau Health Department? All right, great representation. How about from New River Health District? All right, great. How about Mount Rogers? A good contingent from Mount Rogers. I feel like we're at the Olympics, right? Y'all need to parade that. No. Any other health districts that are represented? All right, who else do we have here? Do we have some hospitals represented? All right, where are y'all from? Lewis, Gale, and Pulaski. Lewis, Gale, Montgomery. Any other hospitals? Carilion Clinic, New River. Is that okay? How about you? I'm sorry, I can't hear you. Okay, Centera Health Plans. All right, awesome. And who am I missing? Who else showed up that I haven't covered? Yes. Office of Emergency Preparedness. All right. Yes. Quality Innovators Richmond. All right, love it.
I'm out of state. I work for ETSU.
Okay, College Pharmacy. All right, and what is ETSU?
East Tennessee State University.
I should know that, East Tennessee State University. So great, thank you for coming and representing. All right, so thank you all for being here. A little bit later, we'll be taking a break. So if you get a chance, network with each other and find out who else is here today. These are a couple slides I need to go through just so that you can earn your credits if you're applying for them. You can earn 3 contact hours if you stay for the whole thing today. And I also need to acknowledge that there's no commercial support for this activity, there's no in-kind support, and that there are no exhibits supporting this activity. None of the people on the planning committee, we have nothing to disclose. Our presenters have nothing to disclose. Here's our agenda for today. After I finish, we'll have an Mpox overview by Dr. Lauren Lee. Then Dr. Bafo-Bani will do Mpox vaccination. We'll take a break. Then we'll come back for Dr. Brennan to do Mpox testing and treatment. And then what I'm most looking forward to, we'll have a roundtable facilitated by Dr. Safri Diawara. We'll have some final remarks, and then we'll let you all leave. Of course, I mean, I can't make you stay, but I hope you stay for the whole thing. Do want to let you know, if you didn't get a chance to look, we do have some Mpox materials available on the table to my right. This is just a sampling. Please take whatever you want. There's some things in Spanish and English, but we have a lot more things that are available on the website. So you'll also get a copy of the slides that Donald has actually already put on our website. So you can go on there and order whatever you'd like. There's also additional materials about like what kind of vaccines people need that are adults, including the Mpox vaccine. There's information about integrating Mpox vaccination, testing, and treatment into sexual health and HIV clinical care. And then just updated last week, there's an Mpox information sheet for healthcare providers. So this is kind of a nice synopsis that's going to discuss some of the things that we're going to go over in more detail today. Additionally, something that was just added to the materials, there is a how do I know if my facility's disinfectant will kill Mpox virus? And for any of y'all that have tried to look up what disinfectants will cover Mpox, it can be really kind of a lot to look it up. So there's a simpler way to look up it to see if your specific disinfectant will kill Mpox virus and let you know how long you need to leave it, the contact time, so that it's effective. There's also a syphilis provider packet. If y'all haven't heard, syphilis is really in the news. We are definitely going in the wrong direction. It's affecting more populations, and we've had increases in congenital syphilis. It is something that is affecting all regions of the state. So there's a lot of information in the packet for y'all to be aware of. There's information about diagnosing syphilis and the different stages. There's other information about STI screening recommendations, how to take a sexual history. There's the CDC treatment guidelines, pocket guide. There's information about our dear colleague letters related to the increase in congenital syphilis and also the bicillin shortage. There's also a list of the Virginia reportable diseases and how to do your reporting. And then lastly on the table, we've got some goodies from the Medical Reserve Corps. So if you want to see what they brought, please help yourself to that.